Thank you, Anu, for joining us. Anu is an engineer at the intersection of medtech and public health. She is the co-founder and CEO of Ananya Health, a medical device company building platforms that prevent cervical cancer in the highest burden regions of the world. Prior to founding Ananya Health, Anu led the global programs team at eHealth Africa, where she managed a team of 300 staff that helped eradicate polio in Nigeria. She has built and supported surveillance programs for collecting field-level data to detect and prevent larger outbreaks, and advised large global health organizations on product adaptations for developing countries. She has also designed and launched medical devices with revenues of more than 10 million. Thank you for being with us, Anu. I'm going to pass it off to you.
Great. Hey, everyone. Hi, good morning. I'm just getting like my slide share here, and then I can. Great. I'm really excited to be here. I actually love talking about this particular topic. I love talking to students, and I love talking to people early in their careers because I think there's just so much promise and potential as to what you guys will be working on. And something that I try to impress upon people is like, you know, you guys are all in school now. A large part of what you will be doing when you grow up, you don't even doesn't even exist yet, which I think is a really cool way to think about the world. So you guys can all see me, right? Okay, great. Sorry. Okay, well, we'll get started. I'm having some trouble seeing y'all, but I don't. So let me know if there are any questions or anything. Feel free to toss them in chat, or feel free to interrupt me if you have questions during the talk.
Sounds good. Thanks.
Perfect. So hi, I'm Anu. As Sarah so warmly introduced me, I am a biomedical engineer by training. I got my bachelor's degree in BME from Georgia Tech, and right after graduation, I spent 6 years designing medical devices, sort of the full life cycle of development. And everything from cardiac atrial fibrillation devices to urinary temp monitoring, bladder-based temp monitoring, to a little bit of women's health work as well. So sort of all over the acute care spectrum. And in that time, I was working in all stages of design, like I said, from manufacturing plants to early stage design. And I moved earlier and further and further upstream as that 6 years went on. A lot of design research, a lot of understanding users, ethnography, and then translating that into engineering requirements. Right after that, it took a little bit of a detour, and based on, as all good stories start, I got a phone call from a friend out of the blue in the middle of nowhere, and a month later, I was on a plane on my way to Nigeria, where I thought I was going to spend 2 months. Ended up spending 3.5 years because of Ebola. We were deploying software and hardware for public health. So polio eradication primarily, but also Ebola response, disease surveillance, health system strengthening, et cetera. And there was a particular particular focus for us on how people perceive and use data on the ground to drive health decisions and actions, both at the individual level as well as the clinic, the state and regional levels. So I came back to the US 3.5 years after that, and now I run a company that sort of combines those two things. We build a technology to prevent cervical cancer, which is as much a public health problem as it is an individual condition. So I'll talk a little bit from that experience as well. So quick show of hands, and I'm going to try to, that's why I was asking if y'all could see me and making sure I could see y'all. How many of you are in this field, in engineering in general, in BME in particular, taking this particular class because you want to make a difference in people's lives? And if you're on Zoom, please feel free to get off video or raise your hand in video as well.
Yeah.
All right, we got. Okay. I can see a couple of you. Raise your hands up high if you've got them. Okay, literally everyone in the room. Yeah, everyone wants to make a difference. And I think that's pretty common, right? Like what we all probably have this bend, this idea that why we're doing this is because we want to improve people's lives. So let's back up a little bit. and talk about what technology is, and we'll talk about what benefit and impact are as well. This is the Merriam-Webster definition. Technology is a pretty broad term, right? But this is the Merriam-Webster definition of science and engineering, essentially to solve problems, right? Lots of problems in the world we can be solving. And then maybe a little bit more interesting of a question is, what is benefit, right? Something that produces good or helpful results or affects or promotes well-being. I think most of what we do in the world, most of what everyone's job is about, most of why people get into the career paths they do is that they want to help people and they want to promote this benefit. So to say that, like, oh, I'm in this field because I want to make a difference. It's not that it's not important. I think it is important to have that end goal in mind. But I do think as you get deeper into your careers, it's important to be concrete about what you think benefit means. And that's what I'm going to talk about today. And I hope that's the way that I get you guys thinking in terms of what you want to do next as well. A lot of people tell me my job is very cool because I have spent a lot of times in places like this. Number one, it usually just means that you can't drink the water and you don't know where the bathrooms are, but that's a different story. And I have gotten to do some really cool things, some things that I really love, particularly working in public health. And as one investor tells me, like, working in places that look like this, or working in countries that maybe are traditionally not designed for, don't have a lot of innovation happening in the markets. One investor once told me, like, no one's going to question that this is a good thing to do, to make a difference, to remove suffering, to design for equity. But the harder thing is to define how you're doing actually impacts not just the person that you're doing it for, but the larger community. And I cannot answer for you what impact means, but hopefully I can help you think about it in the context of your own career. And by the way, just in case you're not at all interested in design for emerging markets, just if this is not at all interesting for you, the principles of design for emerging markets aren't different from the principles of good design. It's pertinent to a lot of other markets as well. So technology has always been about making an impact, right? Like from the wheel, which is like one of the earliest instances of technology to absolutely change the trajectory of the human condition, to electricity, to the iPhone. All of these things we can argue have made a huge impact on how the world works. We often think about the positive impacts of those things, but there are probably also some nuances as to some of the negative impacts as well, right? And I put the iPhone up here as a really good example. Most of us have a net benefit from having a smartphone in our lives. Most of us get a better connection out of it. We can connect with people faster. We have more ways of engaging with the world. We can get information much more quickly to make better decisions. But there are also some things, like everyone's had the joy of like forgetting about your phone for a few hours and not having looked at it, and like just getting really caught up in a good concert, or, like playing a game of tag with your friends. And I think we sometimes, like in those moments, we remember how nice it is to not be constantly connected and what some of the negative impacts of technology are. But yet we don't know, when we think about design for impact, we often think about this very narrow definition, sort of the picture that I showed in the last slide. So I wanted to base ourselves in this, even though I'm going to spend a lot of my time talking about impact in emerging markets and creating access to technology. But all technology, anything that we create in the built environment, has both positive and negative repercussions. And I do think it's really, really important to be aware, or at least start thinking about those things in your design process. I'm going to pause here for a second because I love feedback, particularly first thing in the morning. Does anybody have any questions or any comments so far?
Any questions from this group? No, if you can see us. We have some no's, but very attentive looks.
All right. Okay. So actually, I'm going to throw this question out to the audience here. Why do you think, when we talk about making an impact, and lots of people think about, oh, I want to go to Africa and design clean water systems, or I want to go to Asia and work on gender-based violence, or whatever it might be. Why doesn't technology get developed for emerging markets? Why doesn't that happen? Does anybody have any ideas or theories or? Anything they want to throw out there?
We have a hand. Yeah.
Yes, a hand.
I think it might be more about like profit. A lot of it seems to be like if there's not a lot paid back for investors and then good investment. It might not even be good. People even know that's because
Can you hear that?
I can. A lot of it does tend to be about profit, and I think that is a really, really important. It is a probably the base condition. One of the most important things. Any other answers or ideas or thoughts?
Yeah, we have another hand. You might need to come forward or speak up really loud.
Yeah, and there's just like a lot less research and readily available information about emerging markets, so it'd be much more difficult to get started. In contrast to a very well-researched thing, it's much easier to figure out what to do, how to do things, and find other information.
I think you guys have either read my slides or maybe you made them and I'm just reading them to you. Both of these answers are really spot on. They're actually two of the things that I'm going to talk about. Cost or profit or affordability, however you want to talk about money. That's definitely, I think it's probably the first thing people think about. But probably the second thing, the thing that comes right afterwards is that we don't quite understand. We don't have, think of the number of market research reports that are available for various segments of anything in the US and Europe. Everything sort of gets defined from this context. And for engineers or technologists that are in living in this market, trying to design for another one, I think it does tend to be, you just have to work so much harder to overcome those information gaps, right? It's not impossible, but you do have to work really hard to make sure you're questioning your assumptions. Awesome. Anything else before I move on? Any other hands? Any other burning comments? I see a head shaking no.
I just want to make sure that people on Zoom know that they can unmute themselves at any point as well. We have some people not in this class, so please feel free.
Yeah. Great. Perfect, because you guys have already started talking about it. Like I said, I think cost is an entry-level barrier. The basic assumption that a lot of people make, especially if you don't work in design or don't think about these issues, is that people in developing countries can't afford it. So low cost is often a necessary but not sufficient condition, but it's not always. And I think it really comes back to when, think about it this way, when you buy something. I remember being in college and various degrees of not wanting to spend money at various points in my college career. You don't only buy something though. You don't go to the store and say, what is the absolute cheapest thing that I can get? Think about buying clothes is a really good example, right? When you buy clothes, you tend to balance a bunch of different things, how it looks, how it feels, how much it costs, et cetera, et cetera. So even for us, cost is just one dimension of value. And we need to take the time to understand what the other dimensions of value are. What people want and need, of course, but also the assumptions under which people operate, like the way that they think about the world. One really good example of this is, like I said, that I design a portable technology to treat early stage or pre-cancer in the cervix. And cost is important for sure, but probably more important than the cost of the device is, will it work in a clinic that doesn't always have power, right? Like if you can get it to be absolutely cheap, but you need the power grid to be on, the device is absolutely useless. So thinking about, for us, we've actually talked about upping the price and upping the cost because we know we need to add a bigger battery. We have different power assumptions. And that often is the right move, not just making it as cheap as possible, but making it as robust, as portable, et cetera, et cetera. So really understanding that, I think, is a really important thing to do. When something is designed to make your life easier or better, you buy it, right? You don't necessarily only think about cost as the reason why that happens. I know the slide has a lot going on, but I wanted to summarize some of those thoughts. Like new markets, when you think about new markets, markets that aren't traditionally that aren't very penetrated in terms of products or design or technology. Financial information is just one metric that we use. We maximize the dimensions of value that are important to us within those cost constraints, but it's not just about cost. And something that I find really interesting is we've had our financial systems, people have been buying and selling goods ever since civilization, ever since we started congregating in civilization. So literally 5,000 to 10,000 years of having financial metrics and how we talk about money being exchanged. Impact metrics are actually pretty new. We haven't really had a sophisticated discussion around what that is. And one of the things that really excites me about talking to students is because I think in the next, let's call it 20 years, I think the landscape will look very different in terms of what we measure and how we prioritize, multiple dimensions of value. Sarah told me that you guys all read, or the ones of you in the class all read, The Reductive Seduction of Other People's Problems. Is that right?
We will read it.
You will read it. Oh, I can't wait. Okay.
Yeah.
Something I wanted to throw in here. I won't spend too much time on this then. One thing that I hear a lot when we talk about designing technology for a market that maybe doesn't have a lot of alternatives or competitors is, it'll be better than nothing. And oftentimes your competitor is not a product, but it's a belief or an attitude or a behavior that's ingrained in, right? Maybe there's a workaround that people have been using for 50 years and they just don't want to change that flow. And that is often a harder, more powerful thing to overcome than a competitor's product, right? So I won't spend too much time on this. Again, you guys will read this article and I think it will be really, really helpful in context. But remember that you're not always competing against a physical good. To be profitable, we talked about, how investors make money. To be profitable in a new market, you have to rewrite the assumptions that you make that underlie traditional offerings. For our cervical cancer product, Power is a really good example of that, right? The way that we design medical technology in the US, you make the assumption that you're going to have an autoclave available to you at all times. You're going to have, hospitals will never lose power. They've got generators and all of this stuff. And you have a supply chain that, of course, you get sterile drapes delivered to you every couple of weeks, whatever it might be. But those assumptions aren't always correct, particularly in markets that get further and further away from traditional designs. And the bottom line here is, you really have to spend time understanding your users. How do you understand your users? Perspective is absolutely crucial to questioning these assumptions. There is just no substitute for talking to people, and particularly talking to people in the place where they are, meeting people where they are. So much of your information will be nonverbal. So much of a user's day-to-day experience, they can't or don't communicate, right? If I asked you, what have you done since you woke up this morning? You'd probably tell me, I got up, I brushed my teeth, washed my face, grabbed my books, had breakfast, and left, came to class. But think of all of the tiny micro movements. You didn't tell me how you got to class. You didn't tell me, what you ate for breakfast. Some of these really fundamental things that probably give you a lot of rich insight that, people just don't verbalize because they see it as the background noise of their life. Oftentimes, the most interesting things that we learn come out of that. I'll tell a quick story. One of the first things I did when I was working in Nigeria was we were designing a mobile application for people to report levels of vaccine stock data in the clinic. So we would give a phone to every health facility in a particular state of Nigeria. And once a week, they would get a notification to say, okay, open up your vaccine fridge. How many vials of pentavalent vaccine do you have? How many vials of rotavirus? How many, polio, et cetera, and just report on the number of vials, because that gives us a better idea of how many people are going to what facilities, right? And for the largely people got it. People really understood what they were doing. They reported their data, no problems. But that particular morning, we were going to see a clinic who had reported data for 6 weeks and then all of a sudden just stopped reporting. And we said, okay, well, she obviously knows what she's doing. Let's go figure out why she's not doing it. And so we went and we met the health facility in charge, and she's like, oh, I love this application. It's great. It's very easy to use. I have no problems with it. Look, I can see all my data right here. She shows us the phone. Sure enough, she's been entering all of her data in. And we're like, okay, what seems to be the problem? And so she hands me the phone, and immediately in the top right-hand corner or the top left-hand corner of her phone at the time, I see a little airplane symbol. And I'm like, oh, I think I found the problem. And what do we all know about the airplane symbol, right? Like, no data gets transmitted when it's in airplane mode. And so our engineer looks at her and she's like, okay, well, did you realize that this was in airplane mode? And she's like, oh, I don't know what that is. So my friend just told me that when you put this mode on, you save battery. Like your battery lasts a lot longer. And she's right. I mean, that is, categorically true. Not very helpful to us, but this is one of these things that when you look at these assumptions that you make, or that your understanding of technology, particularly when things get developed, with you in mind, these things tend to be invisible to us, like why would somebody do that, or what the assumptions are. It's not that they can't use the technology. It's not that the technology isn't useful for them. It's just, she doesn't have access to a place to charge her phone. She needs to get the battery to last. And this is the way that she's learned to do it. So that changes the way that you design your product, right? That changes the assumptions that you would make. We were already using an opportunistic sync model, but then we built in reminders to say, hey, make sure you take your phone off airplane mode, transmit the data, and implement some battery saving features into that. So I think those are the kinds of things that you really can't get in a verbal explanation or an interview. You really need to spend time with the people you want to use your product. Any questions or comments? Teaching on Zoom is hard, y'all. You can't really talk to people.
I know. We feel that too. Does anyone have questions or comments? Nothing from our group. Anyone on Zoom? Questions, comments? I'm just so glad, Anu, that you're presenting all of this now, because it's going to be really helpful with our discussions coming up in this class.
Awesome.
Yeah.
Well, moving right along then. One of the big, we talked a lot about what technology was at the beginning of this. One of the big things that I think engineers and people who have a background in systems thinking are really at an advantage for is build systems, not stuff, particularly when you're thinking about emerging markets. Technology is often only 10% of the solution, right? A more interesting question is you can design the coolest thing in the world. It can meet all the cost constraints. It can be all of the things, but how will you deploy it? Who will literally distribute it to the places you need to go? Who is going to train people? Who is going to retrain people when they leave, or when new people come in, or when they hire somebody new, or somebody goes on maternity leave? How will you maintain the product? How will you get the parts that you need? How will you maintain whatever backend infrastructure if it's a digital product? And here's a big hint that I've learned in my career working in public health. It's easiest to not try to do all of this by yourself. Who are the other partners that you can leverage in the ecosystem, and what are their incentives, right? What is it that they want out of this? What are the things that drive success for them, and how do you sort of design that in? I think thinking about that early on gives you a real advantage when you get to the brass tacks of deployment and trying to sell your product to people. A big question here, when you're designing an entire system and not just one little doodad, is when you achieve impact, can you drive a positive feedback loop that allows other people to achieve their impact as well? If you understand how all the players in the ecosystem function, or at least the ones that you're going to be working with, if you can understand their incentives, you can often have a way more powerful network effect that will drive your adoption. A really good example of this, to make this concrete, is, like I said, we work in cervical cancer elimination, and that is not an accident. That is not global health tends to be a really hard space to work in. It's a really hard space to wrangle a bunch of people in. And COVID is probably example number one of that. Even though we have this really pressing health emergency, this pandemic worldwide, coordinating people has not been the easiest thing to do. Coordinating countries and having a streamlined approach has not been a very easy thing to do. One of the really nice parts about working in cervical cancer right now is that there's a big global focus on eliminating cervical cancer. So we know that we're not doing this alone. If we're designing technology, excuse me, but if we had to educate every woman in the world about why you need to go get screened and treated, we'd spend all of our time and money doing that instead of designing technology. So we think a lot about what partners can we leverage. Where's the momentum in the market going? How can we leverage that to achieve the impact we want? And how do we think about our product and position it so that everyone else working in this space also wins when we win, And I think that can be a super, super powerful way to get the flywheel really moving quickly. One of the things that I have learned is that need and demand are not the same thing. So do not confuse these two things. Understand that need and demand fall along a continuum, and that our job as engineers and people who care about biomedical engineering in particular is to find ways to bring these two closer along that continuum. This isn't just about technology development. I mean, think of example for writing healthcare policy. In the 1970s and 80s, the US government made a concerted decision to prioritize the need for lower lung cancer rates. And they did that in sort of a multi-pronged approach, right? Like by regulating the advertising, that was a big thing. They affected the demand curve around cigarettes by regulating cigarette manufacturers. They regulated the supply curve, et cetera. There's an ecosystem of support around that decision. And it wasn't just like pull cigarettes off the market, but rather regulate advertising, provide public health funding, run awareness campaigns, et cetera, that sort of brought this public health need closer to what the market closer to what would be profitable in the market, and shaping both of those things in. So need is quantified in global health by things like DALYs and QALYs, disability adjusted life years and quality adjusted life years, and mortality rates and case counts and things like that. But none of those things are actually pertinent to an individual's ability to pay or a doctor's capacity to provide care. There has to be a bridging of those circumstances in order to move the needle in meaningful ways. So it's really, really important to look for this intersection of need and demand and to find ways to bridge those two things, or to be thinking about how you create the intersection of those things, right? Maybe it's not there right now, but how can you, with your work, start shaping the curve to be favorable toward the against the headwinds. I'm going to just take this off of your shoulders right now. You are not here to save the world, which is nice, right? It's really, really important to understand that it's not your job to just save the world. The world is full of complex challenges that need solving. And so my recommendation is ask the people who know those problems really well to join them in doing the work of tackling them. There's a real importance of design ethnography and really understanding your users. And I'm sorry, I didn't get names at the beginning, but one of you said this right at the beginning of like, we don't have great information about non-traditional markets. That's why they're non-traditional. And this is what makes designing with and doing good design ethnography and user research really, really, really important. It's not just something you do when it's convenient. The further you are from your user's lived experience, the more important it is to be rigorous about your research process, and the harder you need to work to understand your users. Something else to remember is that perspective is perishable, right? Like you may have, like I grew up in India. I'm an immigrant. And it's also now been 4 years since I lived in Africa. And I'm really like starting to forget what both of those experiences were like. Like you can remember some of the broad brush things, but you have to keep re-upping that perspective. You have to keep engaging with communities. It's not just that you did it once and sort of checked the box, but continually refining your ideas, your designs, your technologies, but also your assumptions, I think are really important in the world. Great. We're coming to the end, guys. We've only got a couple more slides here. The metrics you use matter. I talked a little bit about this with financial metrics and impact metrics. but this is something to really be thinking about. And this is maybe the thing that gives me the most hope when I think about your generation and what you're going to be able to do. The jobs that you will have in 10 years don't exist right now. And so I wanted to make sure I threw this in here. I run a benefit corporation, and I was really, really adamant that we would incorporate as a benefit corporation. Our statement of benefit is that we prioritize access over everything else. I won't say that we prioritize access over revenue in our benefit statement, but we are the mission of the reason that Ananya Health exists is so we can prioritize getting access to people who don't have current technologies, who don't have a way to get the current treatments that they need. And this is not just about how much you charge. It is not just about pricing and lowering the cost, right? This affects the pipeline of products that we choose to develop. It affects the feature priority, like what we add in. I mentioned battery versus wall power. It affects the pricing strategy for sure. And I think that being able to take the long view on all of those things, to say that we're going to prioritize these things because it's the mission of the company, is really important. Even more than that, for us, expanding access is not just the do-gooder statement. It's not just like, oh, we do that, and because of that, we'll make a little bit less money. We actually think that by designing for 90% of the world that doesn't have current cryoablation technologies, we actually unlock a much bigger market than we would otherwise, right? Instead of trying to compete against the 15 companies that are doing this in the US and Europe, I'd rather look at literally 5 billion people in the world and say, how can I design for a market that just isn't being tapped yet? It changes the timing maybe of the return that you would expect. It changes the way that you talk to your investors if you have them. But I think it is really, really important. Thanks, Jasmine, for this question. How do we balance the needs of investors with those who are going to use your product? We don't see them as competing, right? Investors want to make a return and users want a product that works. And I think when you baseline everyone in that same discussion, it becomes pretty clear. I never tell my investor, I'm really clear-eyed about why we do what we do, and I'm really clear-eyed about the business case of why we do what we do. We're designing a product for every primary care clinic in the world. And it turns out 90% of all primary care clinics are not in the US and Europe. So when I'm looking at the tens of millions of primary care clinics that we are designing for that don't currently have a market opportunity, that's essentially, that's a doubling of the current cryoablation market that exists right now. When you look at the market research report, so it's a $10 billion market opportunity. It may not be a quick exit or like a 2-year sell the company return, but we're building a product and a company that we think is really great for the long term. And I think that resonates with the investors that we need to have, moving forward. Everything we've talked about so far is all about product market fit, a lot of the user research and things like that. That is really, really important to define your product market fit. But as we grow toward the future, something that I believe really strongly in is product business model fit. And business model innovation. So the model you choose not only affects just how you charge for products, it also dictates how you prioritize your pipeline and what features you design, et cetera, where your testing and your deployment staff are. We've already started to see business model innovation. I mentioned that we're a benefit corporation, but that's just one, relatively new type of structure. Traditionally, we've had nonprofits and we've had for-profits. But remember that nonprofits have only been around for about 100 years, whereas for-profit merchants have been around for literally thousands. Just in the last 10 years, we have B Corps and L3Cs and all sorts of social enterprise companies and things like that. And that's literally just in the last 10 years. So I'm really excited to see how this is going to shape, how this will be shaped in the future. And I think we've got some really interesting, innovative mechanisms that people like you will think about and develop further. So the world needs us to think in more sustainable ways, more inclusive ways. It's not going to be optional for the health of the planet, for the health of people. And as our own healthcare market here in the US changes, so do world markets and assumptions. old assumptions don't work with new models. So I think it's important to articulate value in different ways. I realize that sounds really jargony and sort of high-minded. Bear with me for a second. Like, because a lot of these things don't exist yet, you know, I have to sound a little bit high-minded at this point. So, oh, there we go. There are a couple of reasons that I'm so bullish on this market, and I'll get to that in just a second. But remember this: if you really want to make a difference, and your definition of impact is something around inclusion and access and things like that, remember that it's a long game. It's not going to happen probably in 1 to 2 years. Like, I've spent all of my career without knowing it, building up to how we get to impact and access in technology. And, you know, I'm really excited to see what the next couple of years, what the next decade brings in this space. But I also know that I'll say that 10 years from now as well. So a couple of reasons that I'm really excited about it, though, is that there's a lot of cost pressure in healthcare right now, right? Even in the US, it's really, really clear that the way that we have been thinking about healthcare is unsustainable when it's almost a quarter of the GDP, and that's what we're spending all of our money on and not getting any better outcomes. I think whether we know it or not, there is a breaking point, and it's something is going to change probably in our lifetimes. Also, there's a ton of population growth, right? By 2050, a quarter of the world's population will live in Africa. Already 50% of the world or more lives in Asia. So we're talking about larger and larger segments of the world's population without the same assumptions that we operate under here. And it's almost like a Moore's law, but for health tech, right? Every couple of years, the capability of technology gets better and better, and we're seeing an exponential rate of growth in technology. And that means that we're going to see a driving down of price and just more opportunities for innovation as basic science gets better. So I am right on time at 9:40. In case you want to get a hold of me, I don't know if people still use Twitter. I don't use it that often, but it is there. And then there's my email address. If you send me an email, I promise I will get back to you. It might take me a few days, but I promise I will get back to you. So please, I love getting them. I love having conversations back and forth. I'm happy to answer any questions. But for now, I'm just going to open it up for Q&A.
I just want to say thank you so much. This was a fantastic talk, and I wish you could see all of our faces more closely, but everyone is smiling through our masks. So I want to see, does anyone here, I'll try to kind of coordinate hands. Does anyone in this class have questions for Anu?
Amount. Maybe I should talk more about it. You know how everyone tells you it's always about who you know. It's always about your network. I knew from the time I was a senior at Georgia Tech that I wanted to work in public health in some capacity. And I would talk to people about it, tell people that was what my interest was. And a couple of years later, a friend of mine was sitting in a coffee shop in Atlanta. He met a woman who worked for the CDC. He's actually a public policy guy by training, but he ended up getting to be really good friends with this woman, going to Nigeria with her to work on polio transmission surveillance data for nomads, all over the Sahara, et cetera, et cetera. So he spent a couple of years there. He calls me up a couple of years later and is like, hey, I know you really like global health, and we've spent a lot of time talking about it. And I started working for this company and they really need a product development person. What are you doing? And originally I was like, Michael, I am not going to quit my job and move to northern Nigeria. And a month later, I quit my job and was on a plane. But it really was one of these things that is an incredible amount of serendipity. I think there are things that you can do to put yourself in a place for serendipity to happen. But some of it is just chance and luck. Put your interests out in the world. Ask people who are doing things that you find interesting, how they got there. Talk to your friends about what interests you and excites you. And maybe it won't happen immediately, but maybe 4 years down the line, you'll also get a phone call from somebody who's like, hey, move to Antarctica with me. How do you deal with language barriers in your work? Translators, learning even just a tiny amount of local language, particularly when you look like a foreigner, generally that effort is so incredibly appreciated. One of the ways, polio vaccine in Nigeria gets delivered as an oral vaccine. You're literally walking around door to door to people's houses, knocking on the door and saying, hey, are there children under 5 here? And you're dropping vaccine in their mouths. And it's a little bit weird, honestly. Like, that's generally done by people local to the community for obvious reasons. You don't really want strangers, walking around door to door in neighborhoods that they have no real idea of anything. But one of the things when I would go out and supervise polio teams is I learned to say like, hi, how are you? How is your family? How are your kids? And like just being a visible foreigner, trying to wear Nigerian traditional clothing, like just that amount of effort and friendliness, I think goes a long way. That being said, in that particular example, it's very helpful to be a woman because men in northern Nigeria, in a lot of Muslim countries, are not allowed inside a home if there's not another man present. So knowing those local customs, I think, is really important, and working within them. It's not to say that men couldn't do it; they just couldn't go inside the houses. So just, I think, meeting people where they are, not expecting them to speak English just because that's what you do. Just trying to make that effort, I think, is really important. But, translators, a good translator is really important. That's also something I think about in terms of language barriers when we are designing our cryoablation product now, right? When we've got a physical device that we're designing, there are buttons on it and touch screens and things like that. And I tell my design team all the time, icons, not words. Because you don't want to have to translate every single thing, every single screen into 15 different languages or, 1,000 different languages or whatever it might be. Can you use icons and pictures? How can you be smart about the design so that you eliminate some of those language barriers from the beginning? It takes some work to do that, to figure out what a universal symbol for something might look like in that context, particularly around cultural sensitivity, but it can be done, mostly just ask people questions around that. You mentioned that sometimes a local belief is your biggest competitor. How have you faced and maybe even overcome a cultural belief to get people to use products? Asking because sometimes culture is the hardest thing to make changes to. Yes, that is, and I wanted to even briefly cover that slide, even though you guys haven't read it, because I do think attitudes are often much harder to change. A lot of you are working in femtech, right? And I'm sorry for the guys in the room if this is a bit too graphic. Whatever, I work in femtech. I'll just say it doesn't really matter. I look at the cultural attitudes, even in the US, around maxi pads to tampons to menstrual cups and other alternative products. And it didn't really occur to me till about a year ago that this was such a generational thing. Like your propensity to use any one of these products is really tied to what generation you are in and how quickly that can change. And that is purely, like getting women to change habits around their period, particularly when they've been doing something for 20 years, is not an easy thing to do. How can you overcome it? I mean, testimonials are one really good way, particularly in medtech or femtech, or both on the consumer side as well as the clinician side. If you have somebody using something successfully, there's no better endorsement than a doctor telling another doctor, hey, I use this. It's better for my patients and it makes me money at the clinic. Literally, there's no better endorsement than that, right? So finding some local champions that can help you do that is really important. Another good example of this is around the cervical cancer work that we're doing. Our device is part of a large continuum of care. It is not, you can't just function. You can't just drop this device somewhere and say like, okay, all cervical cancer is gone. That's also true. I mean, like HPV vaccine is the same way. Just because we have an HPV vaccine doesn't mean that all cervical or colorectal cancer is gone. You still have to do the education work. You still have to, you have to find locally, culturally competent ways to talk about that and the context of what that is and why you still need to do screening and treatment, even if you've gotten the HPV vaccine, et cetera. And I think that happens in partnership. I'm really, really glad that I'm not the one doing the advocacy work around cervical cancer screening and treatment, that there are groups worldwide that are doing that. And we are lucky enough to piggyback on their work. So my suggestion to you would be get allies. Who are the allies in this space? Who wins when you win? And how can you work together to achieve that? But it's long, slow work, like to change attitudes is not an easy thing to do, but it is possible. Systems thinking is a big one. Understanding that you're not just, it's really important to have like technical design skills, but also making sure that you understand how one thing impacts another and being able to map that process out. One of the best things that happened in my career, when I graduated, I'm going to date myself here a bit. I graduated the semester the market crashed. Most of you are way too young to remember the fall of 2008, but Lehman Brothers had just crashed. The housing crisis was in full swing. Startup companies were shutting down left and right. It just wasn't a great time to be looking for a job in technology, particularly in med tech. And I really thought then that I would go to work at either an investment bank or a nonprofit or a foundation like Gates or something. And I was interning for a medical device company, and my boss there told me, if you ever want technical credibility, if you ever want to call yourself an engineer, you need that credibility now. No one's going to hire you. You can't go to work for the Gates Foundation for 3 years, and then no one's going to hire you as an engineer afterwards, because they're newer graduates that are fresher in that field. Like you can always transition out, but you can't really transition back in without going to grad school. Whether or not that advice is universal, I don't know, but I took it, and I'm very, very glad I did personally. Like that advice for me ended up being hugely, hugely important. I thought I would only spend a couple of years in industry and then I would go to medical school. That didn't end up happening. I spent 6 years in med device before I moved to public health. But that base of technical work that I did, working on manufacturing plans, writing test plans, doing FMEAs, doing, like risk analysis, all of that, that was not directly what I was doing when I was working in public health. But the translational skills, there were way more translational skills than I would have ever anticipated. I ended up writing all of the test plans for our software because I had written test plans before. I mean, I've written them for medical devices, but like putting some rigor in that process, having worked for a big Fortune 1000 company, I think was a huge skill that I didn't expect. So I mean, technical skills will always be important. I can't tell you which specific ones, but being able to have that kind of depth, I think, adds a dimension for sure. When I look at what I'm doing now, I mean, I run a startup. And so my job is everything from like IT support to like talking to lawyers to I make a lot of slides. Like I joke with my friends that that's all being an early stage CEO is you make slides and you talk to lawyers. But I'm really glad that I have that base of technical knowledge so that when I talk to my engineering team, I can understand the challenges and the scope and, can be realistic about what's happening there. Other than that, like be empathetic, be willing to always question what your assumptions are. The most interesting design features will come from things you don't even realize that you're assuming.
Thank you.
You're welcome. What female health / global health problems do you think need to be addressed next? Oh my gosh, pick one. Like literally get out a dartboard. I don't know. I think maybe the better question is like, where is the momentum moving right now? Femtech is a really hot space right now, at least in terms of PR, maybe not in terms of funding. But a lot of what is happening in femtech, female health, women's health, whatever, is happening in the pregnancy and fertility space. That is particularly with funding and exits. And if you read Silicon Valley news at all, that you will be convinced that like we're having an explosion of babies and that's the only thing that really matters. There's a lot of period products out there. So I think there's a lot of focus on consumer tech for those two segments. And that's fine. it's cool to see. I think the ripple effects from that will be really cool to see. But I think there is a lot of momentum, like the Sustainable Development Goals from the UN have a lot of focus on women's health in general, maternal mortality, et cetera. And I don't know this off the top of my head. And I think if I did, I would still direct you to do a little bit of digging, like who is talking about what in the space? What are some of the big global health players talking about? What looks like it's going to have some momentum around it? Yeah, maybe it's a cop out of an answer for me to tell you to answer, to like look at it, but also I keep my head, I keep my head down and pretty focused on cervical cancer these days. So I'm not even sure I'm qualified to give you a good answer.
Thank you, Anu. I think that's a great answer. I'm glad you mentioned the Sustainable Development Goals. That's something we've been talking about as well, and looking into the goals and how they translate to unmet needs. So I think it's a perfect answer. Let's see, we have a couple more minutes. Are there any last question here for Anu before we take off? Anyone on Zoom have a last question? Oh, I see one.
What's next for Ananya Health? Well, we are pre-regulatory, which also means we're pre-revenue. In the next year, we will be hitting a design freeze, which is always a really fun term when you build a product that freezes cells. Like design freeze obviously is a technical term, but I love to make puns about freezing and ice. And my team is like, I'm like dad jokes galore. I'm not even a dad, but whatever. So we're hoping to hit a design freeze in January or February. We'll do our V&V testing and submit to the FDA within the next year. Yes, what a cold response. I love it. That's so good. So yeah, we're hoping to get through the US 510K process and launch sometime in early 2023.
Wow. Well, congrats. I want to do a round of applause here.
Thanks, y'all, for the thoughtful questions too. I mean, a lot of y'all, like I said, you guys preempted my thunder. I love the way you guys are already thinking about these issues. And if there's anything that I can do to help, please let me know. Please reach out. Happy to do it. So.
Thank you so much. This is fantastic. So I'm so glad to see you after a long time, and thanks for coming to join us.
Of course. We'll talk soon. Bye, guys.
All right. Bye, Anu.